Welcome, 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 everyone, and happy Thursday. It is noon Eastern time here in the booming metropolis just outside of Philadelphia, Pennsylvania, a little place I like to call Ambler, PA. Thursdays, noon Eastern time, you know what that means. It is time for Talent Experience Live, your weekly look into all things human resources, talent acquisition, artificial intelligence, talent management, and so much more. This program is proudly brought to you by the good folks here at Phenom, whose purpose is to help 1 billion find the right work. That's why we host this show every single Thursday, where we have a plethora of other great content, including, but not limited to, Cliff Yerkowitz's podcast, Unusual Attitudes, which launches a new episode monthly on the second Monday of the month. Why we have a fantastic webinar lineup. Hop onto our website, check those out. We're coming out with new ones a week. I think last week we did 3 on one day. So anything that you need, very specific to your organizations and your challenges. It's also why we're going to be at every single fall event under the sun, including I Am Phenom Europe, which is in November. This year we are taking our talents to Paris. You won't want to miss it. It is just like our conference over here in Philadelphia, I Am Phenom, the global one, but it's in Paris. So you get baguettes, you get wine, all the good stuff, chocolates and everything in between. So sign up at IamPhenomEurope.com. Anyway, that pays the bills today. That does all of it. Actually, no, it doesn't. Because the reason why we do all of these things, I mentioned, is to help our purpose, but the real way that we do it is through our applied artificial intelligence platform, which helps candidates find the right fit faster, employees evolve in their current roles and beyond, and managers achieve next level productivity and efficiency. So if any of that interests you at all, immediately following this episode of TXL, run on over to phenom.com to learn more, check out our events, check out our webinars, check out the I Am Phenoms, and so much more that we have to offer. Now the bills are paid. Sorry about that little fake out in the beginning. LeBron's in Philadelphia. I'm learning a jab step already. Today we are talking about home health. When a caregiver calls out, AI agents can help you close the home health staffing gap. Over 10,000 Americans turn 65 every single day. That means that more and more folks are relying on home health as each day passes like sands through the hourglass. And today we're going to talk about some of the challenges that arise if someone calls out due to a family emergency, if there are scheduling or staffing changes, and how you can maintain that not only your employees have a good experience, but also the patients that they care for. So I mentioned the webinars a little bit before. This is a webinar that we did with Spencer and Mike, and they dove right into it. Nice little demo in there as well. And it was too good to keep locked up behind a paywall. Not a paywall, I mean like an email registration form. We wanted to give it out to the people. We wanted to share it with you so you could watch it and share it with your home health employers as well. So without any further hesitation, here is Spencer and Mike. Thanks so much.
What is up, everybody? Welcome to today's very, very special webinar. I'm excited for this one because it's all about home health care. And this industry is absolutely booming. And I'm joined by my good friend and colleague, Mr. Spencer Fleming. What's up, Spencer?
How's it going, Mike? Good to be here.
Dude, thank you so much for coming on and for hanging out today.
Absolutely.
Right on, man. So as we get going, if you're just starting to join us today, feel free, drop a comment in the chat. We'll be answering along the way. So let us know where you're from and let us know what are the things that are causing you challenge right now when you're looking for new home health aides, or even to support your business and the patient care that you guys have committed to. Let us know some of your challenges in the chat and follow up if we're hitting them out the park while we're going along the way. All right, so let's jump in and start looking a little bit closer at what is happening today at home health. Today we're going to be talking about the authorized hour. So within home health, one of the biggest challenges that's starting to arise in there is really around how are organizations maintaining coverage and also converting new employees to come into their organization so that they can take care of the patients that are currently in their book of business. And today I'm joined by my good friend and colleague, as I shared earlier, fellow product marketer, Mr. Spencer Fleming, and myself, Mike. We're going to be walking you through this today over the next few minutes. And everything here is all grounded by our purpose here at Phenom to help 1 billion people find the right work. What does that mean in home health? Well, that means that every patient has the aid to come to their house when they need them to. That emergency shift coverage doesn't mean that patient care has to drop. What it means at Phenom to help 1 billion people find the right work in home health, that means that the person who's looking for a new career at 11 p.m. at night, that they are not ghosted by you or your career site, but that they are matched to the right role for them to go into somebody's home and to provide care for them. And so today we're going to be looking specifically at home health, and we're going to see how we're going to be helping 1 billion find the right work today. So what is happening today in the home health industry is very dynamic. What you're seeing is an aging population of over 10,000 folks a day are turning 65 years old in America. That means that each and every single day that goes by, there's a new population that's going to start needing care. In fact, the Bureau of Labor Statistics is saying that by 2034, so a little less than 10 years from now, we're going to see a boom of over 800,000 more home health aides and certified nursing assistants are going to need to come into the market and ultimately into people's homes. And I shared this a little bit earlier, and this is a reality that every single home health professional understands all too well, which is that you guys get paid not only based on the hours that you book, but through Medicare and Medicaid, those reimbursable hours, you have to make sure that you show up for them. That it's not just enough to get the home health aide on the schedule, but if they don't show up and actually fulfill the services, that money does not make it back onto your books. And when rate increases occur, like how we're seeing in places like Texas and Illinois, that's even added revenue that you could potentially add to your book in your line of business if you have the coverage to meet those hours. And all of this is compounded by aggressive mergers and acquisitions. Urgent care centers opening up around the block from you. Hospital networks that are consolidating and growing and who are looking for the same talent as you. All of this is playing into your ability to find the right talent and ultimately to secure home health aides for your patients. And so why does today's HR operating model just simply not keep up with the challenges that are happening today in home health? Well, one, it's that speed. That candidate that applies in the middle of the night most likely won't hear back from folks days, maybe even weeks later. Coverage, you can't control if somebody has an emergency. But now I'm going to show you today with my buddy Spencer how agents are helping fill every single shift in a compliant manner. And ultimately, you want to keep your best people around longer. And so by showing you how you're able to provide coverage and not burn out your people, you're ultimately keeping them around for even longer. And what does this mean for your business? Well, what this means is that for every 5 points, so say if you needed to fill 100% of your home health aide roles, your certified nursing assistance roles, if we bumped you down to 95% filled, that means that your business just lost $25 million. You drop it down again, that's $50 million for every 10 points that you're not able to fill. So today, we're going to show you how you can remain staffed and how you can keep getting new talent in your doors. And around here, when we talk about how is it that we can help starting to apply AI and automation, especially to home health, we talk about it on a molecular level. That's exactly what the hypercell is. It's where we look at your industry, where we look at the role, the function of that role in your organization. We take a look at the geography. You see here how today we're going to be talking about the same role, but one's in Phoenix and one is in Atlanta. The one in Phoenix, the hours are booked, but the coverage isn't secured. And then the one over in Atlanta, well, you need to get more people in your doors and that person's applying at 11 o'clock at night. How are you going to do that? We're going to show you how you can apply AI and automation uniquely to those challenges to solve them. And the way that we do that here is through Phenom's applied AI infrastructure. You cannot, one of the things I've been hearing time and time again over the last few months has been, why can't we just do it ourselves? Why can't we just go to ChatGPT? Why can't we just go ahead and utilize Claude and start building out our own model, training it, getting it to do specific tasks, like maybe it is maybe it is writing emails to candidates. Maybe it is even just scheduling or starting to help you write screening questions, right? The thing is that infrastructure is not built on 15 years of HR data. It all starts at the foundation and the pull of the system. It takes all of your structured and unstructured data and we normalize it. On top of that, that's where you get the ontology, right? Our ontology sits on top of that. Ultimately, that is fed off of 400 million jobs, 1.2 billion candidate profiles, over 50 industries, and 200,000 skills make up this taxonomy, and it's fine-tuned specifically for your industry, for home health care. And then on top of that, we apply XAI, which is our personalization. And that's really where you start to get that intelligence at scale. And from there, use cases start to flow out and experiences for your people, from candidates to employees. And we're able to start providing agentic applications for things like sourcing, for things like screening, onboarding. And we're going to share a little bit about that today with you. And so what could a new reality look like when you start to infuse agents alongside of your recruiting and your talent teams? Well, now you're able to have employees that work alongside your people 24/7 who are trained to run intakes to keep your requisitions up to date between your hiring teams. When agents are infused into a hiring workflow and they're orchestrated with intelligence and precision, the results are astounding. Organizations are cutting 40 to 50% in their time to fill, let alone saving their recruiters almost a part-time salary each and every single week, with 20 hours saved on average per recruiter. And when it comes to screening, one of the hardest things to coordinate for recruiters, 91% of them are getting done same day utilizing the voice screening agent. I'm excited to pass things over to Spencer, who's going to take a closer look at Hypercell One today. Spencer, over to you.
Awesome, thanks, Mike. All right, so Hypercell One. The important thing to remember about the Hypercell is it's all about context. And so the context around this Hypercell is we are in Phoenix, and the role is a home health aide. Phoenix is a market here where hiring is not the core business problem. It's a mature market. Hours are authorized and already sold, and they're on the schedule. The problem in Phoenix is more about shift coverage and making sure that if someone calls out, you can get coverage for that shift. What's the outcome of that? A call out really means a patient that doesn't get care if you're unable to cover that shift. And it's also an hour that was authorized that you don't get paid for. It's also a compliance issue, potentially. And if it happens twice to the same family, it's a referral relationship that you're not going to get back. Nobody in this business calls that a hiring problem, but it's the single biggest and controllable margin lever that you have. Two agents do the work here. First, we have a shift scheduling agent, and then we also have an emergency coverage voice agent. Effectively, those are two ways to accomplish, or two avenues and paths that you can accomplish better shift scheduling. All right, so first, let's take a look at the current state about how things are working today without the aids of Phenom's shift scheduling agent. So, first thing in the morning, 6:40 a.m., caregiver calls out for their visit at 9. 45 minutes go by, the scheduler doesn't even see the call out. It came in maybe as a voicemail or a text. So once that call in does get to the scheduler, you've got maybe an hour of manual roster scanning, find out who's credentialed for the patient, who is under their overtime cap, who can fill this role. And remember, as all this is happening, as that scheduler is calling people that may or may not be available, that time that that patient needs care gets closer and closer and closer. It can be up to sometimes 4 to 6 hours to confirm coverage on a visit that was 90 minutes away when the call came in. So in some cases, that visit happens late, maybe it doesn't happen at all. And the cost of that, not only for you as a business, is missed cost, it's also a cost to ultimately to the care that you're giving to the patient. The same things that we talked about before. And so the current state of this specific hypercell in Phoenix, where scheduling is the main problem, is something that Phenom's shift scheduling agents and emergency call-out agents can help to solve. So let's hop in and take a look at a demo. All right, so now we're going to take a look at how this works with Phenom. So for decades, your scheduling system has told you who clocked in, who didn't, maybe when their certifications might be expiring or lapsed. It might even tell you what shifts went uncovered, but it was reactive. It told you after the fact. And in home health, where the stakes are as high as they are, after the fact is too late. Maybe it helps with reporting, but it doesn't actually solve the core problem. The patient is at home waiting, which is a frontline scheduling problem, but it differs from most other frontline scheduling problems out there. You need to have the right caregiver to fit the right caregiver plan, caregiver that has the appropriate credentials and is under their overtime cap. You have to layer in federal labor laws, Medicaid requirements, your own policies on top of that. Every single visit is not just a scheduling problem, it's also a compliance problem and a compliance decision. And so the real question in this case is not, did we cover the visit, yes or no? It's, did we cover it correctly? Did we cover it with someone who should have been there? And so let's take a look at what that might look like. So we'll go into the Phenom app here, and we are looking at things from the perspective of Sam. Sam is a home healthcare aide in Phoenix, and Sam's first visit of the day is with Miss Alvarez from 9 a.m. to 12. Now, Sam has an emergency and needs to call out. So in most organizations, this is the first domino that falls as the day and the day schedule falls apart. Sam might text a coworker, leave a voicemail, nobody hears, 45 minutes, everything that I just went through a couple minutes ago as time ticks away. Now with Phenom, Sam can open the app and say, I can't make a visit today, and select the visit that they are unable to attend, give a reason, request coverage, done. From there, Sam has called out. The scheduling agent has already been working in the background to notify the appropriate people and to find potential coverage options. But here's the thing about a real emergency. Sometimes you're driving, you're at a hospital, you might not be able to open up an app and request, your shift call out. Sometimes the easiest and quickest thing is to make a quick phone call and then move on. So Sam has another option of calling the emergency shift scheduling agent. Sam can pick up the phone, dial in.
Hi, this is Marcelo from Valley Home Care. How can I help you today?
Hi, I have a family emergency and I can't make my shift this morning.
Understood. I'll help you take care of that right away. Could you please provide your full name and employee ID for verification?
Sure. My name is Sam DeMarco, and my ID is 578-6723.
Thank you, Sam. I've confirmed your employee ID. You're scheduled for the home health aide role for Mrs. Alvarez from Ortier Chishab. And your manager is Sarah Kay, correct?
That's correct.
Got it. I've identified Lauren R., who is BLS certified and has currently worked 4 hours of overtime, well under the 10-hour weekly cap. I'll reach out to Lauren now to confirm the shift. Sam, please go ahead and take care of what you need to today. I'll coordinate the shift coverage and send you a confirmation by text shortly. Does that work for you?
Yes.
You're welcome, Sam. Take care, and we'll keep you updated via text once the shift coverage is confirmed.
Okay, thank you. There you go. So in the time that took, the agent identified qualified caregivers for that shift that Sam was calling out for, knew Miss Alvarez, who she was going to be giving care to, knew that care plan, and checked their credentials, made sure all the compliance lined up, and already has things queued up and ready to go for Sam's manager, who we will switch over to now. So now I'm no longer Sam, I am Sarah, Sam's manager. So here is a look at what Sarah sees when she is in the app, and she didn't have to discover on her own that Sam called out. She gets a notification, and she's told. And she can see here, Sam called out, and the agent has already recommended Lauren R. As a replacement. Very quickly, Sarah can say, yep, that looks good. And the agent can reach out to Lauren, verify that that is an accepted shift. Lauren has accepted the shift, and then Sarah can approve and update the schedule. And just like that, schedule updated. All right, now that we've seen the demo, remember a couple minutes ago we talked about how things go in the current state without Phenom. You saw what it looks like with Phenom, and so let's take a quick recap. So the first thing worth noticing here is that the work of covering the shift started before anyone picked up the phone or the phone ever rang. This shift scheduling agent is always working in the background to match credentials, to understand gaps in the schedule, and proactively understand who can take potential shifts should they need to be covered. So the roster isn't something that a human is rebuilding every morning. It already exists and it's updated in real time. Conflicts get flagged and patients get the care that they need. What was once a situation where patient care was at risk is now something that is covered in minutes. So let's move on to the same role, but in a different hypercell, in a different market. We're going to move over to what things look like in Atlanta, and I'm going to toss it over to Mike to pick up the next section of the demo.
Thanks, Spencer. All right, so we just saw what happens when coverage is necessary and patient care is at risk. But what happens when it's 11 o'clock at night and conversion and needing to get that potentially new home health aide through your door and ready for an interview? We're going to take a look at Atlanta, Georgia. This is a market that is really mature. And what our challenge here is that we have a lot of billable hours on the books, but we don't have enough aides to staff those hours. Today, I'm going to go ahead and show you how when you put together the candidate concierge agent with a pre-hire assessment and the self-scheduling agent, how we can go ahead and take that potentially missed candidate and get them in front of your hiring team ready for the next day. So this reality might actually ring true for you today, right? An aide applies last night, it ends up in your ATS, your recruiter might cycle back through to it in a day or two, skimming through all of those resumes. Not to mention, they don't really have an understanding of their fit. Are they close to the location? Do they have the right skills? Do they even have the right experience? After all that manual scanning and shortlisting, you lost about 2 days. Outreach starts to happen, and that's where phone tag starts to move the minutes into hours and ultimately to days and weeks. By the time you end up getting somebody on and ready for a phone screen, it's probably already been about 10 days since that requisition was originally raised. Once you get them screened, we're probably looking around the 3-week mark until they're probably in front of somebody for a meaningful interview. Typically speaking, for this role, time to fill is hovering just shy of under a month. Why don't we go ahead and hop in and see a new reality with Phenom? So now what you see here is Phenom's intelligent career site. And candidates, they are greeted with not a flat website, but they're greeted with a modern ChatGPT experience. Right from the start, they go ahead and they start prompting right here right from your career site looking for new job opportunities. And immediately the candidate concierge starts to go to work, pulling in insights into all the locations where you currently have jobs open, providing them with an understanding quickly of pay for this type of role in different regions, and inspiration for what it's like to actually work for your organization. The agent then starts to pull in additional insights for them about what motivates them and how they can succeed into the role. The candidate concierge agent immediately picks up with that little bit of intent and asks for some more information of the candidate. Simple things like experience and location. The candidate concierge agent grabs that information and immediately serves up 4 roles that fit this candidate. Now, instead of breaking the experience between chat and your website, it's all now unified into one candidate experience. The candidate now is able to select the job that they're interested in, and we see here that the home health aide role is starting to populate. The candidate concierge agent with scant details of like saying just 2 years experience understands the Atlanta market and lets the candidate know that they are within the top 5% of candidates who would be applying for this job, as well as insights into what a future career path can look like. They can see your whole job description right from this view, maps into location of where they would be going, reviews that are directly tied from your current employees, giving future CNAs and home health aides a taste of what it's like to work within your organization. Once the candidate selects the job that they're interested in, the candidate concierge agent asks for a resume to get a little bit more information. All in line, simple. The candidate's able to upload their resume directly here within the candidate concierge chat experience. So once the candidate's resume is uploaded, the candidate concierge agent starts matching their details to the role. And depending on their qualification, it serves up a situational judgment assessment, which is going to get a sense for how the candidate's going to respond to real-world work scenarios, like providing meals and caring for a patient in their home, and how they work with a team in that scenario. Or what they would do if they saw an elderly neighbor struggling with their groceries. Would they step out in their own personal life and offer to help? That's the type of person who you would want to be representing your organization. Then they're greeted with questions on an agreeability scale. This starts to get to know the heart of the candidate, how they would respond to the protection of moral, legal, and confidentiality rights of patients. We would hope that's very important to them, especially when you're dealing with HIPAA laws and with medical records, right? As well as getting a sense of bias. Based on the candidate's responses, being that they're highly qualified, the self-scheduling agent kicks right off, offering this candidate at 11 p.m. an opportunity to schedule an interview that is right for them, with dates and availabilities that align with their calendar, with their time. And in a few clicks, Daniel was able to go from, I don't know what I want to do next, to having an interview scheduled. And so we looked at this earlier. Today, this could stretch out weeks. It takes time for recruiters to get back to those applicants, to actually chase them down, to schedule those screenings and to start getting qualification signals back to your team to determine whether or not an interview is right. When you infuse Phenom agents into the workflow, what you get is a personalized candidate concierge who then understands the candidate's qualifications and offers them an assessment to get to know whether or not this is the right job for them. And then following that, highly qualified candidates, they're immediately scheduled for an interview. This process completely flipped from almost being a 30-day process to now occurring in under 2 business weeks, right? And so the realities are different. What we saw today is that organizations can go from wondering if coverage could be reached to then having fully covered shifts where patient care is no longer at risk. They go from not knowing how they're going to convert that 11 o'clock apply that their competition down the road is reaching out to currently. They now have a solution with a team of hiring agents working alongside of them. Today, if you heard anything that's of interest to you, I really want to extend this exclusive offer to you. If you have any questions, we have a team of domain experts who are specialized with working with other folks in the home health industry. They are more than excited to hop on a call with you to talk about your current hiring processes, your challenges, and the areas where you want to see improvement, and maybe a little bit about where you think agents can help out too. And we'll put together a whole workflow specifically built for your organization and your hypercell. Spencer, thank you so much for joining me today.
It's great to be here, Mike.
Awesome. Speak soon.